New tonight, a warning about a growing concern among health professionals about breast cancer.
While deaths appear to be on the decline, the number of new cases is on the rise. And there is a glaring disparity when it comes to treatment, even right here in Central Ohio.
So we pause tonight to examine the impact and highlight a key resource giving those diagnosed a fighting chance.
And she said, well, I want to let you know that, you do have breast cancer and it has spread up under your arm.
It's a life-changing phone call Kyra Pruitt-White will never forget. August 12, 2009, a surprising diagnosis, stage 3C triple-negative breast cancer, one of the most aggressive forms of breast cancer found in Black and Hispanic women.
And I'm thinking, well, where do I go? What do I do?
Suddenly, the 42-year-old mother of three in the prime of her career was forced to make her health a top priority.
My full focus was on my family and it wasn't on my health. And I think what happens to a lot of women.
It's a problem researchers say COVID exacerbated, with millions of women missing out on key screenings, causing statistics to climb.
We've seen people since COVID really lag in their medical care. And the need here has jumped by about 50% since COVID.
The Need at Life Care Alliance's Columbus Cancer Clinic, the state's only free cancer clinic, reflects a troubling trend. This year alone, the American Cancer Society estimates close to 300,000 new cases of invasive breast cancer will be diagnosed in women, with more than 43,000 women dying from the disease. For Black women, that number is roughly 40% higher than white women.
And cancer, as we all know, is very often curable. The earlier you catch it, the easier it is to cure. When you wait even a year, it just magnifies tremendously.
But for many, there are hurdles, from financial hardships to lack of health care access. Chuck Gearing, Life Care Alliance CEO and president, says his staff sees the struggle daily.
Well, some people do not reach out for help in the beginning, especially in the minority communities, because of fear of not being able to pay their bills. There are hospitals in this state right now, and have been for a decade, that will not accept you as a client if you are on Medicare or Medicaid. They want private insurance.
Further extending the gap in critical health care between the haves and have-nots, exposing a glaring racial disparity.
That there can be as much as a 20-year difference in life expectancy based on where you live in Central Ohio. It's the inverted L that basically comes down the east side of 71 and picks up the Near East Side, the south end, and goes west.
Which is why the Columbus Cancer Clinic and the free services offered, from mammograms and mastectomy bras to wigs and rental assistance, is a vital lifeline for so many.
In order to have more survivors, we need women and, frankly, men and everybody to go get screenings to detect cancer early, because the earlier you catch it, the more likely it is to be fixed and cured.
After 7 grueling months of chemo, 2 months of radiation, a lot of prayer and support from family and friends, and even thoughts of giving up, Kyra beat cancer.
At the beginning of this journey, I thought that I couldn't make it through. And now I can stand and tell my story that I made it.
Turning a test into a testimony.
I am not supposed to stop telling my story and telling my testimony, because some woman needs to hear this so that they're able to get through this and know that there is an end.
Now, tomorrow there is a free event celebrating survivors like Kyra. It is from 9 until noon over at St. Stephen's Community House in Columbus. Free mastectomy bras, massages, nail polishing, and gift cards will be given out. Yolanda and I will be there to celebrate with our local survivors. We hope to see you there.